shrink the enlargement of the prostate?
No, it really doesn't. But it can vary. It can fluctuate with time. So you're probably equating the two. But honestly, it's probably unrelated to that or minimally related to that. And what the main issue is I mean, you've been eating different foods for the last 62 years and it never affected you. So why is it doing it today? It's doing it today because probably your prostate's enlarged.
Right.
But the best thing, I can't treat you over the phone or over the radio. So it's best is to come in. We can talk about it, examine, and do the right thing. So you're welcome to call us at that 212 Choices number if you wish.
Thank you very much.
God bless you, and have a good weekend.
Thank you.
We're going to hear from our sponsor, and then we'll be right back to take your call. We're at 800-848-9222. 800-848-9222 at the ABC Studios. We're live in the heart of New York City, near our office. Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. We're back with more cases. We're back to take your calls. We're back to tell you the things we do. My name's Dr. Lederman. We work at Radiosurgery New York, which is a private cancer treatment center. Private means we're private for you. We're not run by the drug companies. We're not run by the surgeons. We're not run by a hospital with administrators that you can't see, and it's almost impossible to speak with. We're here. When you come in, we know who you are. You know who we are. And you don't get lost in miles of corridors. So we're located at 38th and Broadway, 1384 Broadway. It's right between Macy's and Times Square, so almost everyone can picture where we are in the heart of New York. We're close to most all buses, subways, trains. We're just a few minutes away from Grand Central Station, Penn Station, PATH trains, Port Authority. So it's very easy to get to us. We have something called the Urgent Cancer Consultants, where if you call us at that 212 Choices number, we promise you that we'll see you within one business day, so you don't have to wait and suffer. We don't think people with cancer should wait and suffer. They should get in, get the right thing done, find out what's going on, like we've talked about today, get the diagnosis correct, and then you who are the President of the United States of your body, you decide after we give you all the options. We accept most all insurances, Medicare, Medicaid, so we try to make it easy that way. So if you have insurances, Medicare, Medicaid, we have a lot of people coming from overseas, and we try to make them as comfortable as we can too. Many people would prefer to be treated in New York than in their home country. So we help those people. We have a prostate cancer treatment center, which means you come in and we offer all the treatments, and I think no one else offers a booklet with the data of surgery, radiation, our brachytherapy, a proton beam, etc. You get all the data, and then you decide, because that's how it should be. You should decide based upon the data. For prostate cancer, there's about 250,000 men a year diagnosed with prostate cancer, so there's plenty of data. Many places don't have the data, don't keep track of the data. We do, and we'll present you our data of our team treating patients just like you. You can call us at our phone number, 212-CHOICES, day or night, 7 days a week. You can speak directly to the doctor. You don't have to speak to the secretary, to nurses, to students, to underlings. No. We know that you want to speak to the chief, and you're welcome to do so. Hey, why did Willie Sutton rob banks? Well, he got arrested finally, and the police asked him, Willie, why do you rob banks? And he said, because that's where the money is. Well, why do we do radiosurgery? Radiosurgery is focused treatment on the cancer. Just like Willie Sutton, we go after the cancer. If you're going to hit the cancer, you want to hit the cancer. You don't want to hit or hurt healthy tissues. So the beauty of radiosurgery is we can focus on the cancer and usually avoid healthy tissues and have high success rates, usually in just a few treatments. So that's the beauty of radiosurgery, and we were the first in America to perform and to offer and to be advocates of this technology, which we've been involved in since the mid-1980s. So, if you have a question, want to speak to us on the radio, our number at the ABC studios is 1-800-848-9222, 800-848-9222. I want to speak about a gentleman who came in yesterday also, Valentine's Day. He's 56 years old, came in for a second opinion. An interesting story. He had blood clots for 10 years. So blood clots are clots of blood that stop up the blood system. So blood isn't supposed to clot. When you have blood clots, think about something else. Don't think just about the blood clot. Like a chess player, think about 5 steps down the road. Why do I have a blood clot? Where is that blood clot? Well, it took 10 years for a disease called polycythemia vera to be diagnosed in him, which most likely was causing the blood clots all 10 years. Now, polycythemia vera is kind of a malignancy of the bone marrow. It can be treated. There are treatments. Polycythemia vera means there's too many blood cells, too many red blood cells in the system. And yes, you can have too many red blood cells. So even those bikers who dope by giving themselves back their blood, they can get into trouble. They can get blood clots, and some of them even die from those transfusions by trying to boost their amounts of red blood cells in their system. The body can only tolerate so much. So he was having blood clots for 10 years. It took 10 years to find the correct diagnosis of polycythemia vera, which was done. And now he comes to us with a non-small cell lung cancer. So there's 2 basic types, small cell, which is treated one way and is less common, and non-small cell, which includes adenocarcinomas and squamous carcinomas and large cell cancers. So there's 2 different kinds of cancers. This man also had lost 50 pounds in the last year. He was 275. He's now down to about 2.25. He's 5'10". And he's got this big mass in the neck. So he felt the mass. He was losing weight. And often when you have cancer like that, the cancer starts eating up all your calories. So you wonder why you lose so much weight? Because the cancer is competing with your body for those calories. The cancer wants to grow at whatever cost. So this man came in yesterday. We examined him. We got the test done. We found that while he's planning to get chemotherapy elsewhere, he really likes the idea of focused treatment to hit the cancer, to try to shrink it down, to have the cancer stop eating all those calories, to try to get the cancer in remission, to have a durable treatment, a non-invasive treatment without cutting and without bleeding. So this gentleman is going to be coming to us for stereotactic body radiosurgery to treat the cancer in the lung and in the neck. Most likely, around 90% chance we can stop it or shrink it. And most likely, as he goes in remission, he'll get back to his normal self. So we wish this gentleman well, like everybody. That's why we're doctors. That's why we take care of people. And we have a way of doing it. And it doesn't only have to be cutting or chemo. There are other options out there, and you may want to explore the other options now or before you start actual treatment. So, again, we have a booklet and a DVD, and the best is to make an appointment, come in, meet with us, and go over all the details and look eyeball to eyeball and hear what options are available to you. So, we have a caller on the line, and good morning, Barry. How are you?
Hey, good morning, Dr. Lederman. How you doing?
Fine, thank you. How are you?
Okay.
Good.
Recently, I've been diagnosed with squamous cell cancer behind my right molar.
Uh-huh.
And at this point,
It's called retromolar cancer. That's the area of the mouth is called the retromolar trigone.
Okay, and thank you. They wanted to the options that one of the major hospitals has given me is that they wanted to cut, and they also said maybe the cancer has gone somewhat into the bone, so they wanted to take like a portion from my leg just to do a graft in the event they have to go into the bone when they cut into that. Do you guys there at your facility, you handle that as opposed to cutting?
Yeah, of course. And the beauty is, the problem is sometimes when you go to cutters, you get the answer to cut, and they tend, like in you, they're trying to do, they're probably doing a flap or a transfer from your leg. They're probably taking out cancer. But the fact is, squamous cancers of the head and neck area, and all the head and neck from the mouth down to the windpipe is called the head and neck area.
Okay.
Are very, very sensitive to chemo and radiation. Mm-hmm. And I have to examine you and look at your records, but most likely you could avoid that big operation. And that big operation can have a lot of complications, and your mouth may never be the same because the skin from your leg doesn't produce the mucosa, doesn't produce the moisture that the tissues in your mouth do. So it will never be equal. It's a big operation. When they start cutting on the bone, they can cause problems in the bone, either with infection or what's called osteomyelitis. So, yeah, it's a work we do, and you're smart to call. You're smart to call before anything is done.
Okay, because, right, like I said, right now I'm in the stage of just going through the testing and stuff like that, all of the scans, so I can make a decision. But like I said, it's a major situation for me. So I figure, I heard your show, and I figured let me call and, get a second opinion from you guys.
It makes a lot of sense. If you want, we can send you a booklet. We have a booklet on head and neck cancers and a DVD, which is a general introduction. So you're welcome to do that. And give me a call anytime if you want to talk more privately. You can call us at the 212 Choices number, which is 212-246-4237 after the show or during the week.
Thank you. Thank you. I really appreciate it. Thanks a lot.
All right. God bless you, and thank you. Bye-bye now.
Okay. Thank you. Sure.
We're going to go to our break, hear from our sponsor, and then be right back to take your calls and talk about more cancer information. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212 Choices. 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212 Choices. 212 Choices for Radiosurgery New York. At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212 Choices, 212 Choices for a fresh second opinion and a free booklet DVD. conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment,